COVID-19 to the agenda. Hey there. Hello. Okay. Okay, very good. All right, we'll add, want to add COVID-19 discussion to the menu, and I'll call Sarah. He's ready to come in.
Both of them. That's Gene's voice. That phone number one is.
Okay, so I will entertain a motion for the approval of the agenda with that addition.
I'll second that motion.
Okay, we have a motion and a second for the approval of the agenda with one addition of COVID-19. I'll call for the vote. All those in favor say aye.
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 And opposed? Okay,
Who had the first? I didn't hear that.
I think it was Gene, and then Neil. I think that's who I had it. The next is the minutes from last week's meeting. Any discussion on that?
I thought the minutes read well. I'll make a motion to approve those minutes.
I'll second.
Okay, we have a motion and a second for the approval of last week's minutes. All those in favor say aye.
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 And opposed? Motion carries. Okay, the first item up is to approve the payables. I did have a question on one payable, and Courtney and I had some discussion on it. I think I understand kind of what's going on. It was in Veterans Affairs, was the large purchase of Fairway cards. I assume that those cards are purchased and given to veterans. I assume that we are logging them and keeping them in good order on a spreadsheet, the recipients. So I'm just assuming that that is all being taken care of correctly. Does anybody have anything to add to that?
Well, Rich, I had the same questions as you did. I seen this late on the weekend, and my biggest thing is make sure that we get how they're distributed. If that's what's going on, I mean, they need to be distributed equally, regardless. I think, in a veterans thing.
Well, yeah, and my only thought there is I really want a record of where they're going and how much is happening there, so we have some accountability for it. I assume that this has been going on for a while. It's the first time I've ever seen it. So,
I have a concern that probably we're doing this so we don't have to send money back.
yeah, that's what I think.
And I don't know if this is the right approach to do that.
If there's a need for it, I want it. If there's not a need for it, I think that should be discussed. So
Yeah, I had the same question, that came up on my radar. Courtney, we've never done that before.
I believe so, yes.
You believe we haven't not done it?
You have.
Oh, we have done this before.
Yes.
Perhaps this time we have it explained to us whether it's been done before or not.
Right.
okay.
Yeah, I think that'd be good to have him come in and explain that.
Well,
It's a large sum. It's a large sum of money. I mean, are there 550 veterans in the county that are getting these cards?
I don't know what our policy calls for. I don't know how much that policy calls for, and I don't even know if there even is. If I don't know those. Those are my questions. And I think that, and I don't know whether we should approve it this time and have him come in and explain this so we know going forward what this is all about, or we should withhold that. And that's money out of his budget. We've already spent it, so I assume that that's already been taken out of the account. Is that correct, Courtney?
No, the check will,
Okay.
yeah. But the only thing is this is our last bill day this fiscal year.
This fiscal year.
So if you want clarification on it, I guess I would recommend approving it pending some clarification on that one. That way we can at least pay it if you guys feel that it's okay to pay. Otherwise, we aren't going to be able to pay it until next fiscal year, and that defeats what he's trying to do, I think.
That makes sense, Courtney.
Yeah, I like that idea as well.
Okay, any more discussion on the payables?
Yeah, who's going to determine whether or not the expense is acceptable?
I think we should, why don't we just leave it up to the budgetary people for that particular, and that is, who has Veterans Affairs?
Gene Miners does.
And Neil Bach.
Oh, yeah, that's right. That's right.
Okay, so will you two get us some clarification on that program? And
Well, I think we need to hold them accountable, but I don't know if we should hold up paying the bill. And I think we pretty much think we understand what the situation is, and so he just has to be a little bit more forthcoming, I would say.
well, I just hope for the state auditors question that may come, that we have an accurate accountability for that. That's my biggest concern, is that there's a spreadsheet, dates, names, all of that stuff is,
Well, or do we have him come in the next board meeting and explain to all of us?
whichever way you guys feel. I mean, if you do want to contact him and feel like you get a good solid explanation and you're okay with it, you can give it to us, that's fine. If you want to have him come in, I'm fine with that too.
What do you think, Neil? Should we go and see him, talk to him first?
I'm out of town until Wednesday morning. I'm calling in from out of town right now. So it'll have to wait that long for me to do more than a phone call, or he'll have to meet with the entire board.
Yeah, well, it'll be after late Thursday afternoon before I'm available too. So we could, do something Friday or whatever, and then if we want to visit with him, and then we can have him still come before the board.
That'd be fine. Friday would work for me. On Wednesday I have Rolling Hills, and on Thursday morning we have Shive Hattery. So let's get together before Friday and talk with him. Okay, Gene?
Yeah, because I've got a meeting late Thursday afternoon too. So okay. You want me to try to set up time with him to meet with him, or?
Yeah, I will check, but I think I'm pretty well. Yeah, I'm pretty well open on Friday.
Okay.
I'm open. So anytime Friday will work.
All right, I'll try to set that up.
Thank you, Gene.
Okay. We also have, I have a request from the auditor's office that we add Matheson, a company, Tri-Gas Incorporated, to the payables. It is a medical oxygen.
It's for the ambulance, and normally I wouldn't do that, but this is a May invoice, so it's past due. So, and since that's a local business, I want to be current with our local vendors.
The total on it is $115.36.
Why did we receive it so late? Do you know?
I don't know.
Oversight. I don't know.
Well, maybe maybe we didn't get the first one they sent.
You had to send another one?
Yeah, I don't know.
No, I agree. I don't want to be late.
Any questions about that bill? Because we can see it and you can't, so. No. Hearing no questions, I guess I'm looking for a motion to approve the payables.
I'll make a motion to approve the payables with that one addition and the oversight that will be going on with the Veterans Affairs claim.
I'll second that motion.
Okay, I'll call for the vote. We have a motion and a second for the approval of the payables with the addition of Matheson that just came in this week. I'll call for the vote. All those in favor say aye.
Aye.
And opposed? Motion carries. Okay, the next thing is General Assistance Department discussion. Chad, I'm glad you joined us today.
Thank you. Good to be here. Thank you.
Gene and Chad, I'll turn that question over to you two and lead it wherever you would like.
Well, we've been working on this, and I've had conversations with several of you, and we looked at this as far as a way of contracting this service out, and also probably by doing this, we're going to be able to expand more options for the clients to get into different programs so they get more back on their feet and become part of the society. Chad, you want to go over any of this, or?
Well, new opportunities. We just really appreciate having the opportunity to possibly provide these services. As you all know, is there some vibrating? Okay, that might be better. Is that better? Yeah. Okay, sorry about that. I have two. Anyway, now you can hear me good. That's the main thing. Well, as you all know, New Opportunities, we are a community action agency. And so as a community action agency, not just in the state, but this is a nationwide network where we're providing low-income services to our low-income families, I should say. So we're doing everything from WIC, maternal health, child health. Of course, we're doing substance abuse prevention and treatment, strong mentoring programs, food pantry, energy assistance. We're doing all these different services for our low-income residents here in Carroll County. And of course, as you all know, one of the requirements of general assistance is that the county needs to be the payer of last resort. So the previous employee would call us, of course, on every client, and we would refer clients over to general assistance to make sure that the services are being provided, to make sure that you are in fact the payer of last resort. And so it's going to be a really good match. I think it's going to be a good marriage for this program because we're going to be able to provide the client with lots of different services, making sure they're getting our services first. And if they've used up all of our services, well, then we would look at yours, this county relief fund. So I can sure answer any questions that you may have. I have spent some time kind of putting together more of a manual, which is not something that Carroll County's had before. It's really for your use, but it's also for our employee that would be providing these services, kind of a clear-cut way so that everyone is on board with what services are being provided, the dollar amounts, how often the services are being provided, and all those kinds of things. So just to kind of overview it, right now, and I believe it's going to stay the same, is a low-income person at 200% poverty can get up to $500 for different services, whether it be medical, energy, utilities, rent, dental, all these different kinds of services. But you get $500 per year if you even need that much. So it's not like you get $500 for a doctor's bill, $500 for a prescription, $500 for rental. No, it's $500 total. And you have to meet the qualifications of 200% poverty. Of course, we're working with the poverty guideline, the federal poverty guideline every day, so we know that very well. We do that with the majority of all of our services as well. We've had great audits, great reviews, as Gene can attest to. We're very good with paperwork. We're very good with spreadsheets. Our CFO is top notch, that we will be able to provide documentation and proof of everything we're doing. We're looking forward to working with Courtney to figure out a strong vouchering system of how we can get the paperwork to her. She'll know exactly what the service is for and who the vendor is that we need to pay, and we would go from that point on. So any questions you might have, I can talk more, or it's probably a pretty good general overview maybe.
Well, I think we,
Well,
go ahead.
go first. Please.
Gene,
One thing I was going to say, that we've done this, everybody's gotten a copy of this over the weekend, the 2080 agreement and the manual. John did draw up that 2080 agreement, and I think it's, I was thinking more on the line of a contract, but I think this 2080 agreement fits more for this type of program. And I did have John take a look at that manual. He did have one line that he would like to have changed, and did I send this on to you, Chad?
No, I don't know of a change, but I'll sure take it. What do you have?
On line 4, he says on page 4, or not line 4, but on page 4, where it says the client must properly identify himself or herself by providing the general assistance worker with a minimum of 1 photo ID card. He suggests they be changed that the client must properly identify himself or herself by providing sufficient information to the general assistance worker. I think he put that in there so there's more flexibility, and where you could maybe require less or more if you have some questions.
Okay, I wasn't able to write that down really quick. So after the meeting, Gene, maybe we can get together and I can get that exact verbiage and I can change that, no problem.
Yeah. Okay.
The only maybe comment that I would have, if everyone would be able to go to the agreement that John Worden put together, under Article 6 for termination, I see that Carroll County has got the option of canceling within 30 days. We would prefer that New Opportunities have that ability too, and can't see that we would do that, but just as kind of protection, that it might say Carroll County and New Opportunities may cancel upon 30 days written notice. And then typically how I do these kinds of agreements is up there under Article 2 for duration. John has got 120 days. Typically I keep all these the same. So if it's 30 days termination down below, I would do, to renew the contract, it's also 30 days notice, just to keep it really consistent. But of course, that's at your pleasure. But for sure, the termination of New Opportunities would like an option to do that as well, which I don't foresee us wanting to do. But
I think that's a good addition, Chad. Gene, and that 120 days came out of a conversation between Gene and I. We had some concerns whether if something would develop underneath the county wing where we might merge them back together. We wanted to give you as long a notice as you could to protect you, and also give us time to get maybe everything well organized before we made that move. The 30 days, I definitely agree with you. You should have the option too, because if it's not going well for you, or you have a change in your employees, or you have some unknown circumstance that we don't know of yet, it gives you an option to maneuver around too.
thank you. Okay.
Yeah, I don't see a problem with that.
No. And I'll jump in here a little bit. Gene and I have been, I don't know how many phone calls we've made with each other, and the things that I have seen here is, it's a good program. There were not many guidelines. It was a lot of gray area. And I think this gives us the opportunity to tighten that up some for protection, not only for ourselves, but for the client too. It's more definite for them that they know exactly what they can get, what they cannot get. And I think that was a big plus. And I thank Chad for writing up this manual. I mean, there's been a lot of back and forth between all three of us, but it looks like, I think we've got a good product, and I think we got a good solution.
Yeah, going in this, I had two concerns. One was that the manual would be used instead of County Ordinance number 19, and that's not the case. It's in addition to Ordinance 19. So that has been, is not a concern of mine. I have had a little bit of a concern in that we are contracting out the job. The person doing it is going to be a direct employee of New Opportunities, not of the county, so they're one step away. That's just a small concern of mine. That having been said, I think New Op is a good match, and they have a lot to offer in services that are closely related to this, and I think it's a good match. And I also wanted John to look at it, and I'm glad that he has.
Yeah, I think it's a good thing too. It'll be definitely something better than what we've had, simply because of the detail involved. The only couple questions that I have is, Chad, will there be an individual that will be dedicated to the general assistance, as opposed to, well, I've got it this, I'll take it over, or just have one person dedicated to this?
Yes, we'll have one person dedicated to this, and then her supervisor will be trained in it as well. So that way, if there's a sickness or a lengthy vacation or something like that, we'll always have somebody in charge of these services.
Okay. My next question is, this is probably for Courtney. Do we have any kind of case file that, was there some documentation of the last 6 months or the last year or anything like that, as far as we know? Have we paid out $500 already, to a lot of these individuals?
I've been unable to find any specific client detail. We have the claims that we paid out. Of course, those don't say who they're for. They just say how much money was spent. So, unless I'm not looking in the right spot, but I haven't found anything.
Dean, I had a equal concern that there would be a person and not just an entity involved, and Chad has explained that to you and I both. I doubt we needed to make many payments recently with everybody getting a check from the government. But, I hate to say it, but that payment from the government, the checks, the $2,500 or wherever it is, came at a time when, we didn't have to make we shouldn't have had to make very many, if any, payments.
Yeah, I would agree with that. I guess, and this contract starts with Chad on July 1st. So does is that when the $500 client benefit starts then, or how are we doing that? Is it a fiscal year or a calendar year, as far as the $500 benefit?
Do we start it on our budget year or a calendar year? I guess
That's my question. Yeah.
Yeah.
I would think you started on calendar year if I have any input, but I don't know. You'd have to find the records from January to the present to make sure. And I don't know where you all are at with that. So.
Oh, Dean, Carl made mention here just a second ago that he would dive in through the PC that was over there and see if he can find anything that pertains to conversation or emails or anything that Courtney can't see. He would do a little dive through there and see if he could find anything of those type of records.
And it could be a non-item, actually. I mean, Courtney, you've got a pretty good idea what was paid out dollar-wise. I mean, do you think it was a significant amount or not so much?
Well, it's all in the budget. So, I mean, anything that was paid, there was a check written and there's documentation on that. My concern is I don't know what client those claims were for.
Sure.
And yeah, you might find some of them, but are you finding everybody?
Yeah.
I guess I'm not sure. Yeah, it makes more sense to do it on a calendar year, but our funds are available on a fiscal year.
Mhm.
To me, it makes more sense to start fresh July 1st, but I don't make that decision.
Courtney, how much have we allocated as far as appropriated for benefits in addition to managing the program? Do you know?
I don't have her budget in front of me, so I can't really answer that. That was one of my questions. You know, we've said everybody can, or people eligible can get up to $500 of assistance. Is that going to be subject to budgetary restraints because the county
Yes.
X number of dollars, and once
You know,
that's done, I guess you've done.
it's on a first come, first served basis and when we're out of money, we're out of money, but I don't know what that amount is offhand.
I'll email each of you the
Well,
budget.
I think I can kind of give that to you. I think it was roughly a little over $18,000. I've got the budget sheet here in front of me.
Okay.
In
So
fiscal year 2020?
Yes. 19 through 20.
All right,
It's a little
but you don't
over-
have, do you have 20 and 21, Gene?
No, I do not.
That's going to be the same, except there was an increase for salary.
And you know, and I remember it's first come, first serve until the funds are gone. But I know we've reallocated, particularly on the funeral funds when we've kind of had unexpected funerals. We have done that in the past.
Yeah, I recall that too.
I think if Chad or the person running it, the new ops, runs up against our budgetary amount, they would contact us.
But we're gonna,
Yeah,
part of this is quarterly report too, isn't that not so, Chad?
that is 100% correct, is that we will provide you with a quarterly report. And I'll work with you, Rich, and Gene, or whoever else, but you know, we need to get together in the next week and look at what you want that quarterly report to look like. I've kind of got an idea in my mind of a nice spreadsheet. You know, maybe it'll just include, you know, first name, last initial, and then, I mean, I need to look at that. I need to look at that so that you have an idea. For sure, it's going to be, you know, client X, you know, receive this service for how much on such and such a date, and we'll put that into a spreadsheet so that we can monitor that quarter after quarter and year after year. The biggest thing will just be, you know, if you can give me the dollar amount so that when we're getting close, I also, you know, our staff will also know kind of where they're at with budgets and that kind of things, to give you plenty of heads up to know that, you know, we're above or below or whatever the situation is.
You know, and back to what Neil said with the checks for $1,200 per person coming out, that may skew the results a little bit for the next, if they do another program, that could skew it for some. So, well, I think we're gonna have to adjust this on the fly. I don't think we're gonna have a good handle on to at least get 12 months underneath our belt and see exactly what we're gonna need to be done doing.
I guess the only thing that I'm a little nervous about with what you're saying with that is that those stimulus monies, that may not be enough to take a person off of 200% poverty though. I mean, if we have a really, really low income person, I mean, we're going to have to look at that and look at, how was that money spent, to make sure it wasn't spent like gambling or, tobacco, alcohol. I mean, really work with the client. And that's, again, why I think we're a good fit, because we've got a great financial literacy program where we're helping clients with budgeting and financial management and that sort of thing. But do you understand what I'm saying? Is if we would get another stimulus check, that may not be enough to disqualify the person from this program.
Okay, yeah, I
Okay.
understand.
In my opinion, as long as Chad, I think what you offer is a good service, and I think it'd be a good partnership, as long as there's documentation that is provable after a certain amount of time, meeting with us quarterly. I also am going to say, I know you said you'd prefer it to be calendar year, but I think for budgetary purposes, it makes more sense to stick with the fiscal year. So.
I'm very okay with that. I'm okay with that.
Good.
Yeah, I'm good with that. That's fine.
And I think that might be a good point. I think like Courtney said, to start with, being we're starting with this contract or this 2080 agreement in July 1st, that's the beginning of our budget year. Let's just start with the funding that way too. I think that'd be a good fit. It also helps if we don't find out any more information on that computer.
Do you have input for this one? Yes. Okay. We have a person today that would like to have a little input to it. She'll state her name, and remember, you're kind of limited to 5 minutes, so, but go ahead.
My name is Linda Worley. I have an extensive career. I have an MBA. That was disrupted when I moved to Iowa. My insurance exam was tampered in Harlan, and they did an investigation for 2 months, holding me out for 2 more months. And they kicked me out of my home in Harlan because there was a drug ring, and I was a witness, and they had illegal surveillance. The county attorney, Marcus Gross, criminally kept my deposit. So I wrote a letter finally after 2 months, and I got it back immediately. I'm dealing with that with Shelby County. So I'm giving you the history, how I ended up needing your funds. I moved to Iowa because I love the green. Colorado has a gay governor, and it's got a lot of problems right now. It's my home state, but I wasn't comfortable there because it's become what you're seeing on TV. So I came to Iowa because you have a female governor, and I liked the people. So I went all across your state helping seniors with insurance. And I don't have time to tell all the horrific things, but in small town hospitals, they don't get the care they need. So I felt like I was a real good liaison. That was taken away from me on October 15th also. So I had my rent monies criminally stripped from me from the county attorney for 2 months. I had to borrow funds. And this is all on, when you talk about the history, to get a good history of what people are using the funds for or what their income is, that needs to be really strong. I totally agree. From what I've seen around me and how I'm an accountant, how stringent I've been, as far as dedicated to the laws. So I was stripped of my job as far as the exam, but they conquered it. They fired the Health and Human Services Director in Des Moines the day I got my license. I went to Georgia for training, borrowed money to get a special Medicare training, came back, went all over your state, but again, I moved to Arcadia. And honestly, probably a lot of you know who I am. I have 4 pending court actions, and there's going to be more. And I'm sorry, but I've tried to build up to this. I want to really commend, I worked with a lady in Des Moines for Life Heap. That was very helpful, even though I hardly use any air conditioning, but it was helpful. Council Bluffs tried to keep me from having that. My unemployment was hacked at your Carroll office. I reapplied for an Arcadia, but I knew I couldn't do it in my apartment because they were tampering with my internet, so I went to a pastor, used his computer. Then he was hacked, so he was mad at me. This is really toxic, I'm sorry. So I'm explaining to you, I'm very proud And I don't like taking money. I'd probably get a big bunch of GoFundMe if I just started talking. But I went to Lydie here, and the lady was very nice. I forget her name, but I want to commend her. She's got blonde hair, and she's just really a great person. So I want to say that. I want to say that building, when you want to shift that, diversify the duties to them, it's a brand new building. It's hardly has any traffic. It's perfect. You know what I mean? It's comfortable. You can sit distance from everybody. So I wanted to contribute that. I'm still broke because after Marcus Gross took my deposit and I endured so many corrupt landlords, my age, I bought a little RV. That was a blessing. It was a real blessing. And I've been living in that because I could go wherever was sent for my seniors. But that was actually broken into and damaged in Littlefield. I reported it at a supervisors meeting, and I want to say I got no help from the police. I got help from the supervisor once I talked to him. They fired 3 cops. And when they tried to steal my RV, a sheriff was fired in Atlantic because he threatened me on Valentine's Day. He was going to blackmail me and steal my RV. So it just doesn't end. It's because I say no, basically. No to drugs, no to breaking the law, and people don't like somebody that really stands on that premise. So right now, I moved from Arcadia to Carroll, and I want to commend Rosie Stotts. She's professional. She was understanding. She's licensed. She didn't know me from Adam. She knew how to listen. She knew how to take down the facts. And she helped me like $200 so I could get out of this toxic, horrific, drug-infested Benami mafia, I call it. And it has all to do with the camper grads that think they're above the law. Well, unfortunately, I right now am living in a home with a camper grad and across from the camper school. I'm holding right in front of you a document that says, because I reported these fireworks that your jailer lit her husband under my RV and my tenant, and they didn't stop even after the police told them to stop. And when the police come, they don't take it serious. They think it's all funny to mess with me. And so I did finally call him because when I moved out of the house, literally I've been living in my RV on Clark Street, across from campers who needed to be safe. And in so doing, 2 days ago, this tenant took his flashlight with his friend, Hardy, he's 40 years old, acts like he's 16, shined the light into my home. Yep, she's getting there, ha ha ha. I have on recording the most profane, slanderous. He's advertising my financial to the neighbor. It is the most horrific, and I'm talking. So what I'm letting you know, I have full intentions to leave this floor and go to the next. I'm going to take Sheriff Kretzinger to court. I told him about this for 6 months in Arcadia. He laughed at me when they took my UGG boots and they cut them up, let me know we're in your home. We can do anything we want. They tore my pillows and they destroyed other property. So what I did was I went to the sheriff. Here, yesterday I went to the police and I went to take these and the sheriff was leaving with the police. Okay? So I want to let you know, when I told Kretzinger all these horrific things, he laughed at me and said, oh, that's just wear and tear. So by him giving them a license, my car, every time I needed to go to court, they messed with the battery, they messed with the tires, they messed with the locks. So that's why all my court matters are all linked. So I'm here to let you know that Rosie was the most golden star could be. She helped me get out of that horrific, toxic situation. But the most creepy thing is the day that she helped me with fuel, within 24 hours, she was sick in ER. That really bothers me. And also all of a sudden, she had people coming there saying, we're going to give you an evaluation. And then all of a sudden, after she helped me, and I'm having all these things I'm dealing with people with lots of money that think they're above the law, she loses her job. So I talked to somebody about it. I think it was this gentleman on the phone. And I said, I hope it wasn't because of me. because I have given full substantial documentation of all my income. I don't eat out. I don't smoke. My neighbors below, they have pot. They drink all hours of the night. I know how much alcohol costs. I know how much pot costs. I know cigarettes. I don't do any of those. I don't eat out. So one contributing factor, my time's up, contributing factor. When you say you're gonna help people with a budget, and a combination of people with a budget and with addiction, I think you should know where their money goes, because when you give them a fish, the Bible story, you give them a fish and helps instead of just money. I use the money, but that's because I am who I am. I'll give you the information before you can ask for it. But I think before you give people money, I think you should know, like you said, what they're spending it on. And the guy below me has a brand new TV, but see, I have a car and I have an RV, so all the neighbors around me think I'm rich, but I'm not.
Then you're gonna have to wrap
Okay.
up. We need.
So I think knowing if you offer to help them with a budget, you'll not only have their income, you'll have their expenses. So you'll help them know how to manage their money. You'll know exactly what they have behind it. And the only other thing is, I do want to get to the bottom of why Rosie's on, because she was awesome. And I think it's pertinent to my situation. And I do need your help with the sheriff and the police, because they haven't helped. I've had horrendous things. I've got it all on recording, and they aren't being helpful. So I don't know if you want to help or if I should just take it legal.
Well, thanks for your input, Linda. I spent quite a bit of time on the phone with you one time, and I reassured you that your situation had nothing to do with Rosie Stott's ending of the relationship she had with us. The other part, if you think it just so you want to do a legality issue with us, I guess you're going to have to pursue that. I don't think we are the judge and jury here of anything. So I really do thank you for your input. I'm glad they all got a chance
I
to
just
hear.
wanted you to know, because what I've endured, most people would never have to do it. So it's really bad because I'm by myself. They know that. They know that. And they're very bad for it. And I already talked to the sheriff at the police station. He just laughed it off, said Chris, it was good. So I'm just like, in fairness to you, I just let you know.
Okay.
Okay.
Thank
Thanks
you.
for the time.
Thank you.
And Rosie was awesome.
Okay.
And my youth has been really good.
Okay.
And I needed it. Thank you.
Thank you.
It's only temporary.
Okay.
Thank you.
Anybody else have anything else to comment on the general assistance program?
So do we have a couple changes we're gonna make, some wording, and then approve or deny this next week, or what are we gonna do?
Yes, that's the next trick. If we want him to take over the fiscal year of July 1st, we need to move forward on this 28E. And there was a couple of changes, Gene. There was maybe some wording that Chad would like to iron out.
I think the only wording that we need to worry about is what's in the 2080 agreement. That's the document that we're going by. The manual is probably a working document that as things change, things will change. And that is, I think that's something that can be done on its own after the fact, really. But both of them are really simply word changes. I think a guy could approve a subject to those changes.
Okay, so is that the wishes of the board that we pursue the 2080 agreement today to get it in place so we can turn these services over July 1, which is a little over a week from now?
If Chad agrees to whatever is in our 2080 agreement, I see no reason we can't proceed today.
Okay.
So the two changes I had were Article 6, have it say Carroll County or whatever, new opportunities may cancel upon 30 days. And then we talked about possibly changing the days in Article 2.
Oh, that's right, having them both the same.
Yeah.
Chad, what days would you prefer to have there?
I'm okay with either. I think with 30 days, that may be a little short on the county end. If you wanted to switch gears, which or if we wanted to switch gears, it might be rough on you to get this thing re-implemented in 30 days. So you might consider 60 days, which is kind of in between there. So, I mean, God forbid if we were to say, you know what, it's just not working out, to give you 60 days notice gives you lots, time to figure out a plan B, and vice versa, I guess, for new opportunities as well. I mean, I like 30 days, but we got to be smart about this. And I'm thinking for the county, that's pretty short to get things turned around, even though we've done it. But it's been a lot of work between Gene and Rich and I. So,
Wow.
and everyone has had.
Government entities are a lot slower. You know that well. I think I agree with Chad. I think let's move them both to 60. Let's let them both of those places state 60. That shouldn't strap too many board members from kind of reacting fairly quickly. And it gives Chad plenty of time to make his decisions and move forward too, so.
I have no problem with that.
Yeah, I'm okay
Okay,
with that too. If there's a possibility that we're not going to have our meeting on Monday and move it to Wednesday, it would be a good idea then to approve it today, I think. And
That's a topic that's coming up, Dean, and I think that you're probably correct. That's probably what we should do, because we need to appoint a treasurer, and we can't do it until July the 1st. So the first working day after that would be that Wednesday, so we could get it done in the morning. And by 9:15, we should have a treasurer in place to keep the transition moved. So, okay, so I guess, are we willing to just go ahead and vote on the 28E accepting today? Okay, I'd take a motion on that. I would make the motion we pass the 28E with the change of 60 days in both of the discussed areas. And what was the other?
Add new opportunities to Article 6 on termination, where it says
Okay.
Carroll County or new opportunities.
With the addition of the new opportunities being added to Article 6. Is that the one you would add some concerns with too, Chad? Okay.
Yes.
I would make that motion with those two changes that we accept this 28E.
So then you would also change the dates on Article 2 and 6 to be also 60 days then, is that right?
Make them both 60. That way
Okay.
they're common.
I'll second that motion.
Who had the first?
I did.
Thank you.
Okay, any other discussion on that particular?
well, the only thing is, I think that should be ran by John, just to make sure that there's, out of respect for him, because he drew up the initial 2080 agreement. I mean, I think we can still go ahead, but I just want to make sure that he's aware of the changes that we're making.
Yeah, I agree. He needs to see it, and with those two changes, Gene or Courtney, you send it to me or just send it to John, please.
Okay.
And with those, and just have him just note those two changes. And if he's got any questions, he can call Gene or I.
Okay.
That okay, Gene?
Yeah, sounds good.
Okay. Okay, so, well, I'll call for the vote on the approval of this 28E with those two changes, subject to John's approval. I'll make a little amendment to my motion. And Neil, will you still second that part of the motion?
Yes.
Okay, so I'll call for the vote. All those in favor, say aye.
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 And opposed?
And I will abstain due to the fact that I'm president of New Opportunities Board.
And I understand that. Chad, I gotta thank you. Been easy to work with on this deal. I think, like I said, I think this is a large improvement for us. I thank you for your time and your effort on this.
Thank you. Well, we really,
Go ahead, Chad.
Well, thank you. We really appreciate the opportunity and are looking forward to our ongoing relationship. And Courtney, I'll give you a call in a couple of days and we'll firm up some of the paperwork process so we've got a good plan by July 1st. So.
Good.
Thanks, Courtney. Thank you all.
Thank you.
Do you
Thanks,
want,
Chad.
you want us to just change that manual and bring that back next week, just for your blessings?
Yeah,
Talking to me? No.
I think we should run the manual through us one more time with the changes, just to
I
get
mean,
one.
the only change we're gonna have is that one sentence, but we can do that.
Right.
And then we'll bring it back next week.
That's fine. But the 2080 is going to continue to move forward.
Yep.
Okay. Thank you, Chad.
Thank you all very much. Thank you. I'm going to log off now.
All right, the next subject up is the jail project change order. We had some questions on some things there. I don't know what they were.
I got the notes.
Yeah. I remember we did receive a comment from Shive Hattery on the questions that we did have.
You sent this on, didn't you?
I thought so.
Yeah, I thought it was a good explanation of what those change orders were.
Some of them I knew, but there was a couple that I couldn't recall exactly what they were. But now that I read it, I remember we discussed it, so.
Yeah. I'd agree with you, Rich.
Okay, so that brings up another point. We're gonna have a meeting with them this upcoming week. So if they're gonna recommend any changes, I wanna have them, once we discuss them, I want them to send us an email so we have it in our hands, so it doesn't get 40, 50 days from now and we have that, what was that again?
I agree with you, Rich. I think that, we want to try to minimize the change orders, but I mean, we need to be realistic that there's going to be change orders. But I do agree with you. I think there need to be some more documentation there so we don't have to bring this back up again.
Okay.
So with that, do we need a motion then to approve the change order, right?
Yeah, the county needs, or the chairman needs to sign the change order, so I need at least a motion to authorize the chair to sign it.
I will so move to that effect unless someone else has any other questions.
I'll second it.
We have a motion and a second to authorize the chair to sign these change orders. I'll call for the vote. All those in favor say aye.
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 And opposed? Motion carried. All right, the next subject up is a fireworks permit for Joe Gilbert. I did not read that.
It's on July 4th, 170th Street.
Okay. Any questions about that?
I'm confused.
I'll move that we approve the fireworks permit for Joe.
Okay, any other discussion? And a second? I'll second that motion. I'll call for the vote. All those in favor of approval of the fireworks permit, say aye.
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 And opposed? Motion carries.
Signature on this too, Rich.
The next item up is the approve the plats.
Should have two here.
Any discussion on the plats?
They were pretty well straightforward. I'll make a motion to approve the plats.
I'll second that motion.
Okay, we have a motion and a second for the approval of the plats for today. I'll call for the vote. All those in favor say aye.
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 And opposed, motion. Next thing up is a Class C liquor license for Angry Beaver. Any complaints written or,
Not that I'm aware of.
okay,
I'll move it, we approve the Class C liquor permit for Angry Beaver.
I'll second that.
okay, we have a motion and a second for the approval of the Class C liquor license for Angry Beaver. I'll call for the vote. All those in favor say aye.
Aye.
Aye. And opposed? Motion carries. All right, item 7, the manure management. Oh, Sarah. Please, and tell her where she's up. There was one today for Justin Schroeder, section 33 of Wheatland Township. That's a crop rotation and changes to his MMP. Okay, next thing up, we'll do the committee reports. If anybody would like to go first.
I'll start. This is Neil, and Monday I did the radio and a newspaper, and I did state that the part of the meeting was not on broadcast live, but it was available on the website if anyone wanted to see our meeting after the meeting. On Wednesday at noon, I had the Coalition of Human Services. There was no general program, but we each gave a rundown of what we've been doing in our different agencies. I think there were about 15 people that participated in the meeting. Thursday morning, I met with Chad Jensen and Jean and I with concerning the county general assistance, and we've been over that, but I want to thank Gene and Rich for his previous input on that. Thursday afternoon, I had a community for children decategorization board meeting. And first of all, we approved the juvenile court services transfer of funds letter, which we had informally approved at a previous meeting. It amounted to $65,000, $65,500 to be exact. And they designated $20,000 for student-based mental health in Carroll, $15,000 for student-based mental health in Greene County, $7,000 for pre-charged diversion, which some kids need, and we had some money left over that we did disperse to an organization called NAMI. They got, which is the National Alliance of Mental Illness. They got $680. We also approved some money for to General Crisis or Family Crisis Center for a Community Against Bullying, and Carroll First Church for family funding. We also had the coordinator's review on Molly Scott, our coordinator, and she got a very good review. On Friday, had the second judicial meeting, and we hadn't met for quite a while since our previous meeting was scheduled for, I believe, March, and it was not held due to the COVID. So we had a lot of business to take care of. We had a nominating committee report and election of officers for 2020. I'm again the supervisor's representative. We had the purchase of service agreement with the Department of Corrections. We had the review of the CEO, Amanda Milligan, and she also had very good reviews. And I've been in situations where we haven't had good reviews, and it's certainly a pleasure to have a good review both on Molly with the previous program and with Amanda on the second judicial district. They have lost some revenue due to in their facilities due to fewer people being held. However, they gained some back by not replacing people, having less travel. The end, they're down a little bit on funding, but they're going to cash flow anyhow. They're intending on having a $332,000 carry forward into fiscal year 21, which starts July 1st. Those were my meetings. And this week on Wednesday, I have Rolling Hills. On Thursday, I'll meet with Shive Hattery. Any questions? Okay. That concludes my reports then.
Thanks, Neil.
Yes.
No, said thank you.
Okay.
I can go quick. Last week I had a daycare meeting on Monday and then the Emergency Coalition with you guys on Thursday as well. And then also I received another call in regards to face masks being worn by a certain company when they're going out and doing walkthrough on different properties. So I'm going to go upstairs when this meeting's over and have a conversation with Cindy to reach out to that person and see if they will voluntarily start wearing a face mask. And then this week I have a daycare today at noon, and then I have the radio and newspaper and ambulance meeting on Wednesday, and then a jail meeting on Thursday, and then the Emergency Coalition meeting on Friday.
Okay, I'll go next. This last week, Tuesday, I went to Manning for that DOT meeting. On the 141, they're doing a project down there possibly next year, the way it looks like. We're going to take it from 4-lane down to 3-lane and use the center lane for turning lane. And then also on some of the major other intersections, they will have a right turn lane also for short distance. It's about a $1.2 million project. That was on Tuesday evening. The rest of, and then Thursday, I did meet with Chad and Neil in regard to the general assistance. And I did spend quite a bit of the whole week on general assistance. And then on Friday, I had the Yes Center board meeting. We did approve the financials. We also then voted on our yearly budget, and we set a budget for about $745,700, which shows us in the good for about $81,000. We reviewed our workman's comp policy and that bill. We did renew our contract with DHS for our rent of the facility up there, which surprisingly went down. It went from $293 a square foot down to $261 a square foot. They had about 9.72 kids in there per day for May, and then since in June so far, they've averaged about 11 kids per day. We've gotten kids also from Bureau of Indian Affairs in there, and also some kids out of Polk County. So things are going quite well there. This week I have a CADC meeting tomorrow at noon, and then Thursday would be the jail meeting in the morning, and then later in the afternoon I have a new opportunities board meeting. That's my week, and I'm sticking to it.
I can go next. There was a scheduled conservation board meeting on Monday night. That was canceled due to COVID-19. There was an individual from the conservation seasonal employee tested positive, and one of the board members had 4 individuals test positive at his workplace. So Jason decided to go ahead and just cancel the meeting. However, he did send an update. I sent that to Courtney to send out to all of the board members. Then I had a call from Mark Hansen from Dallas County Supervisor on the North Raccoon River Watershed Management Coalition and his concerns about the resolution that we signed, as well as 6 other counties. We had a lengthy discussion about it, and he just wanted to know what was going on. My thing was, my biggest concern is and I relayed to him, was the 48% nutrient reduction goal that was in the plan. And he said he would look into that, but I'm sure I'll be calling, or I'm sure I'll be talking with him again this week. The plan is up for public review right now through the month of June, and it'll be voted on at next month's meeting. So I'm kind of slogging through it right now and seeing if there's anything else that catches my eye that needs attention. But anyway, we're going to move ahead on that, and I'm sure I'll be talking to more supervisors about that plan and how we will probably move forward with it, whether we agree with the plan or not. I had a emergency call. I attended the emergency coalition meeting on Friday, and this week I'm sure I'll be talking to Mark Hansen, and I agreed to talk to Scott Jacobs on Region 5 and how we're going to be moving forward there with the workman's comp issue that's kind of open right now. So that's it from my report.
Thanks, Dean. Keep us informed about the watershed. I think that's kind of the, I think it's a difference of opinion, and I think we'll get past it. Yeah, I don't think the coalition will.
Yeah. Everyone got a letter from Rhonda Ringenberg from the from Buena Vista, and they're concerned, and I'll be speaking with her as well, I'm sure, this week. So.
Thanks for keeping up on that. My week consisted of several phone calls. I talked to Gene quite often, and several other people about some concerns that they had.
Took it out of that department.
I did attend got in on the coalition meeting on Friday. After that, I left and went to Jefferson and stopped by the prisoner home. Another prisoner home has been brought into Jefferson, and it's should be up on its foundation this week and finished up a little bit. And then they'll start on the garage. They have another private contractor on a single stall garage for it. Quite impressive. It looks good. I didn't go through it, but Jefferson had a very good place for it. They had a good plan, and I think the house looks extremely well built from the outside. Well, that was it for last week. This upcoming week, it appears there'll be a couple other touch-up calls, maybe with Gene, maybe before the week's over. But we'll see how this. I've got to call John on a couple of different subjects. Wednesday, we have a Zoom meeting with Carroll Baker, the city of Manning, and a couple of people from down there. Their current person that runs Medic 6 out of Manning has taken another job and will not be the ambulance director down there anymore. Just the time constraints are too much for her on the new job. So we're gonna be discussing the path forward for what's going in store for Manning, see if we have someone else, and see if we have a plan. So that will be on Wednesday. Thursday, then we have the baiting shy battery. I assume that's a Zoom. I haven't looked at my email, but I assume it is. That will be Thursday. Like I said, I'll be talking to John on a couple of different subjects this week. And then the upcoming meeting, while I've got you on committee reports, Courtney made a good point that, well, we have to have a trader July 1, so we need to have a meeting either the first of the what day is that?
So Wednesday.
So we're gonna think about moving it to Wednesday, which would be the first working day. Plus that 4-day weekend will keep people out of the courthouse for 4 days, and that might be a benefit to us for a little while, to get one of those little breaks in there. So if you guys don't care, I think I'm gonna move that meeting to the Wednesday following the 4th. And then we can kind of do some cleanup on the other issues and whatever else comes in between now and then. Okay.
Rich, make sure it's in the morning, because I do have an afternoon meeting on Wednesday with Rolling Hills that
Okay.
I
We'll
should
go
attend.
We'll go at 9 o'clock, just like normal.
That'll be fine.
That'd be the Wednesday after the 4th.
Either
Be
Wednesday.
fine.
Before the 4th.
Yeah.
I'm sorry. Okay. Next thing is COVID-19. And Sarah is here, and she has a few topics of discussion. And one of the first ones up that I'd like to discuss is people visiting. We put a limit on the county that you visit of 200. We have a current employee that's visiting, or 2 of them that visit a county of 600 because we have a contract with them. They're doing their best. They're doing exactly what they're supposed to. They drive in, they do their job, they're outside, they come back. So they're kind of exempt from this. But my concern is if you go to one of those and you come back and you spend 10 days, maybe for nothing. So I think we want to revisit that. I'll turn it over to Sarah now.
So we have some employees that have health issues and just maybe need to go see a specialist in Omaha or Des Moines. So they're gonna be traveling to those counties. I mean, Des Moines, whole county's over 5,000 cases. So if an employee has a medical appointment, they go straight to the doctor's office. They're most likely gonna wear a mask at that doctor's office, get in their car and come back home. The employees would prefer not to have to wear a mask for 2 weeks. We're getting into the thick of people going on vacations. So the numbers are increasing in every county. So I think that we need to, that 250 policy, I told you I kind of had some concerns with that in the first place. I know that the state of Iowa, for their state workers, they lifted that, but then they put some more emphasis on what happens when you get the call about you've been in contact with someone. So they just told their workers to heed the 6-foot distancing rules, be smart where you're going. You know, no one wants to be the one that brings us back to the county. So, I guess there's been a request to maybe even eliminate that 250 because the case numbers are just going to keep going up. There's several counties in Iowa that don't have that, and it's mainly because our testing has increased in the state of Iowa. So, or like we talked before, if a person goes to South Dakota to go fishing, you're not by anybody, you're outside, but you left the state, then that automatically puts you in the you can return to work and put the mask on. So with the numbers going up, Okoboji went from 14 cases to over 200 in 2 weeks. So there's going to be several workers that are going to get that call. I mean, it's just something we're going to have to deal with, that you've been in contact with somebody who's been COVID positive. I mean, and then we've had that discussion too. When the person who's positive has to go back, they have to go back 48 hours prior to where their first symptom was. And then they really have to think about who was in their 6 foot of personal space for more than 15 minutes. So even if I came and talked to Courtney and handed her a bill or looked over her computer screen, we were working on something, as long as I was not in Courtney's 6 feet of personal space for 15 minutes, Courtney's not going to be on my contact tracing list because we weren't in there. So that's where that 6 feet, just constantly reminding people to be smart about what they're doing. Keep that 6 foot of distance in between people when you're talking, having conversations, doing county work. So I just think we need to visit that, and then Courtney needs to have either enhance the pandemic plan or enhance the COVID plan, whatever we want to call it, as to give our employees guidance as to if they get this call with the contact tracing. So we have the 10 days paid in place. So each department had to come up with who's essential versus non-essential. All of the contact tracing stuff also changes, as Sarah stated. She thinks it's changed 4 or 5 times already, because if you're considered essential or critical, so critical infrastructure is going to be your law enforcement, your EMS workers at the 911 center downstairs. So those are critical operations that have to keep functioning. If one of those workers would get a positive or the contact tracing, your spouse, your child has it. The guidance says as long as you are symptom free, you may return to work. But at that point, they have to wear a mask the entire time because they were either positive or they were on the contact tracing list. As I told Sheriff Pingree, if it's a worker that does not put you in the lurch without having that person here, Public Health, Iowa Department of Public Health would prefer for that worker to sit out the 10 days. But then do you want that worker to work from home for 10 days? Are you going to pay them for 10 days? Does that count against their 10 days of COVID, even though they don't have it? They can be at work if we make them wear a mask the entire time. So there's a lot of gray area that the department heads have to figure out, as well as if Courtney can just put it in black and white so that people can, all the employees can read, this is what happens. Because what happens, you get the contact tracing call and you burn up your 10 days. Well, then let's say in 2 months, you get it. You've already burned up your 10 days. So now at that point, the employee is on their sick leave, I'm assuming. Well, if they're newer, they're not going to have as much sick leave. Then round 2 in the fall, the child gets it, and then they need to be home for another 10 days because we've got really strict daycare rules going on. Now are they into their vacation days? So it gets really muddy really quickly as to essential versus non-essential. If you want the person working from home, then you know what I mean, what are the expectations of the people working from home, because you really don't want Jean's office to get it. And if Jean can, with her having the most employees, if she can deal with that person not being there, that's the best case scenario. But then what are the expectations she has of that employee working from home so that they don't have to use their, I'm going to call them golden 10 days, or get into their own sick leave or their vacation time for this. We got 6 more months of this.
I'm just, okay, bear with me for 1 minute. In the last 3 months, we have literally done a full circle back to, oh, you have it, but go back to work. So don't you think I don't know. I am extremely just confused whether this is political or if this is true or what it is. But how can you say, because 3 months ago, if a person had COVID, stay home, dang, you're almost planning your funeral because that's going to happen. And then now we're saying, come back to work, but if you haven't, wear a mask.
Because they're finding you're mainly spreadable with the symptoms. But then at any point in that time, because like with Jason's department,
Yeah.
you know, if one person would get it, well, how far apart are those workstations? Has anybody measured down in the 911 center? Or are those two workers considered kind of like a roommate where you touch the same bathroom handle, the keyboard, the phone, the microwave, the refrigerator? So his department could go out rather quickly with
If they get
one
tested.
yeah.
Because more than likely if they all have it.
Plus if they get tested, yeah.
It's interesting.
But if that county department can not have that person there, it's still ideal
For them to go home.
for that person to go home. But then, are they using the 10 days? Or are they working from home?
And then
That's
we have-
something where each office is gonna be different, because some offices you can't work at home, and some you
Mhm.
can,
And
so.
some people, we have some instances that are part-time.
And we have
So do you
critical,
continue paying?
essential, and non-essential. There's 3 categories of workers on that sheet. Non-essential are supposed to stay home.
And I have talked to people that have tested positive over the phone and they have no symptoms and they would be fully functional and able to work. They don't want to just sit there. But then you do have the people that do get sick and are truly sick. So they wouldn't be able to function.
But then, I would think then you use your golden 10 days.
I'm blown away by that.
Well, even if you're asymptomatic, I mean, you can still spread the disease. So, I mean, I think that's kind of the way it was confusing out at conservation, whether he's riding a mower all by himself out there, can he come back to work? Even when, you know, I think they had him stay home, but, you know, he was asymptomatic. He had no symptoms. He just took the test basically almost on his own. And
Like you said.
so I don't know. I mean, I think you still have to be very cautious. But I also think that as far as the general public is concerned, I think it's every man for himself right now, to be quite honest with you. And which is, I guess it's okay for the business sector, but you really have to be careful. And
Well, I think this relates to working at home or whatever, and that's gonna have to be entirely up to the department head.
Well, I think we probably should just drop the 200 part out of the rule, and kind of leave this, but we sure want the employees to be reporting it, where they've been and what situation they're under. We don't want to discourage that
Because if they feel like they have to go to work
Correct.
and then they are positive and go to work positive, you know.
So I think the department heads are more in tune to their employees, more in tune to what's really going on than we are. We see the employees, but we may only see them once a week, once every 10 days. So,
well, as far as the 200, Sarah, you're referring to the 250 cases? Is that what you're referring to? Going to an area that has 250 cases?
Yeah. And then,
Okay, so
just say then they have to come back and wear a mask for 2 weeks. at
Right.
work.
So I recall Dr. Hine commenting on that probably over a month ago already. You know, when we had widespread spread going on, that she says, well, you know, then you're not going to be able to go anywhere because there's going to be a lot of communities in Iowa that are going to have 250 cases. So, I mean, that was commented on, and I agreed with her at that time. I don't think that, I think you can remove that, to be quite honest with you, because it doesn't apply anymore.
Yeah, I mean, we have so much of it everywhere, and if you're not 250, you send them over. So,
I think it really has to be, are you saying, Sarah, that this really has to be like on an honor system? That,
It absolutely needs to be on an honor system, or it's gonna, if we have somebody come, and that's why I think you just need to spell it out a little bit more, or have each department head then submit how they're gonna do it. So that you know the coverage and that employee knows where they're at with their leave too. Does that make sense? Oh, so do I have to use vacation for this because I'm out of sick leave?
So isn't it's if you test positive, you get 10 days paid, correct?
Yes.
Yeah, or the
Or
other things.
or if you're caring for someone that did
Yes.
test positive.
Yeah.
husband or caring for
Child.
someone. or
Within
yourself.
your home.
Yes.
Right.
But if you're the contact tracing, so you can use that on the contact tracing. I would hate to use that because you're just kind of in this waiting period. You're in the, am I gonna develop symptoms or not? And if you never do, but if you can work from home, is we're kind of back to, like you said, it circles back to when we sent people home, then they work from home, but now that everybody's back, but if you get contact traced, well, then you can work from home again. But then if you get sick, then you go on the COVID, right? And
If
you
you
need
test
to be
positive,
honest
yep.
about that. Because what they're finding is the people that are gonna get it from the contact tracing, it usually shows up between 5 and 7 days after they get that phone call. So like you said, you might be feeling fine and being able to work from home. And then all of a sudden, boom, I get the fever and I feel like garbage. I get tested. Well, now I feel like then you're 10 days of the paid, you're not working. You actually have it would start. Does that make sense?
Can you contact track this twice?
There's people in the media that have said they've gotten it twice. Yeah.
Positive. So you can burn through your 10 days
Yes.
and.
You could burn through your 10 days just saying, well, I've been contact traced. You want me to stay home?
Right, so yeah, that's what I say, if you use contact tracing as a
Yes.
source, then.
But even the flu, you don't get paid time off for the flu, and that comes around twice a year.
Yeah, I know.
This is eventually going to be titled as a flu eventually, and there'll be probably a vaccine at some point.
That's why they call those the 10 additional
10
COVID
days.
days.
Right,
Until there's a vaccine.
Yeah,
when did that
End of the
die
year.
at the end of the year?
right? And December
Mhm.
2020.
So
Of
are we
course, that was a
just,
guess at that time too.
are we saying we're just gonna remove the
100, 250.
part where it says until further notice, any county employee that travels for county business or for personal outside Iowa or Iowa County with more than 250 cases? That's gonna be just removed altogether.
Mhm.
Yeah.
Are we still saying that the travel for county business outside of the county is suspended until further notice? It does say that you can go with department head approval.
I mean, everything's been canceled. I don't,
Yeah. That's under the travel section as
Yeah.
well.
So.
I think the governor, she
Did-
lifted
did
up
you guys
basically
hear
all
that
that. I mean,
question?
we might as well too.
Did y'all?
Yeah, I'm trying to find it here. I'm trying to find it. I haven't been successful, but, oh, here we go. No, that's not it. Well, one thing, I mean, it's, you can, some people will not show signs of COVID-19, but there are also those, and I think we've had one that was in Carroll County that got extremely sick. And there's no, they're in the hospital for 3 weeks. So what are we going to do, about a situation like that? If we get an employee that does get the coronavirus and just basically is out for a long period of time. I mean, that's something that we're going to have to deal with as well. Oh, well, I'm not saying we're going to have to deal with it, but I mean, we have to be prepared to deal with that.
Well,
Yeah.
they'd get the 10 days and use sick time or vacation time for the rest. So, I mean, that'd be no different than getting cancer and being in the hospital for 3 months.
That's true.
That's what FMLA is for, protects your job. The only thing is if we get a new employee, you have to be an employee for 12 months before FMLA applies. So if that did happen to a new employee, the board may have to make us,
special exemption.
you know, if it was okay with John, can we allow that person? And I think it's up to the department head to hold on to somebody's job, but yeah. And I know it's different, but I look at this illness just like any other illness, whether it's cancer or whatever. We have employees battling that and they're missing work and they're using their sick time or they're using personal time.
Right.
So it's kind of similar, but not.
Yeah, I would agree.
So I guess what we're allowing is you can use those golden 10 days if you feel like it, but remember, they're gone, they're gone.
And so do you just want to leave it up to, if the employee gets the call on the contact tracing, then they gotta work with their department head.
I think we leave it up to the employee, the department head, public health. I think we let those three people sort it out. Are they gonna be that much of a risk to us, or are they not gonna be that much of a risk to us? If it's the employee that's riding on a lawnmower all day long and he can come and go and
Feels fine.
feels fine and doesn't touch anything other than that lawnmower, doesn't go in for his break time, or, you know, and isolates himself from working, but isolated. If that's okay with the department head and he thinks that's an okay thing, and you think that's an okay thing, I think we just let them go with it.
I do want to say that I kind of compared to having cancer and being sick. Cancer's not contagious.
Yeah.
So that's,
Correct.
I'm just
Yeah.
thinking, well, that makes things a little different. You have somebody that's contract traced, you're in an office with a lot of people. Is it safe for them to come back in if you've got everybody on top of each other? Well, maybe not.
So maybe they go home for their golden 10 and when they come back, they have to wait.
And maybe you can find duties for them to work at home, or,
We all know what office we're talking about because the other ones are all spread out, but
yeah.
it'd be the treasurer's office. What does she do if one of the gals comes in and says, this weekend and so-and-so's got it, what do I do? Do I stay home or?
Traced and
Yeah.
Is there proof? Is there like a contract tracing? If you receive a phone call, like, do you get a letter to even show to your boss? Be like, here, you know, because you're gonna want proof of some sort. Otherwise,
I think you could ask for,
you certainly.
yeah,
I know you're gonna see a positive test of COVID, but
yeah, I bet you can ask for that, but.
I think there's been some ignoring of that, where the individual calls his boss and says, you know, I was in contact with someone and they said that I cannot come back to work for 14 days. And the employer says, no, you are coming back. I have heard. Sarah, have you heard anything about like that as well?
Yeah, I've heard that, and then I've also heard because each business, all of the public health, it's recommended, it's not mandated. When public health calls somebody, it's recommended they stay home. It's not a public health quarantine mandate with an ankle bracelet that you stay home. So businesses have said, oh, as long as you get a negative test, you can come back to work. So there are people that have gotten a negative test. So let's say you got called on Monday, get a test on Tuesday, came back negative Wednesday, because the tests are coming back fairly quickly now. We're within 24, 48 hours tops. So then they going back to work Wednesday. Well, they started feeling cruddy over the weekend, but their test was negative. So it's like a false sense of security, because I got tested and my test was negative. So they went back to work on Monday until they had a blazing fever, and then got tested again the following Tuesday, and now they're positive. So it took a whole week for that to come. But those tests are not going to show positive unless you have those symptoms in you. So, so then public health said, well, that was the whole point of the self-isolating for the 10 work days.
Well, I'll just make this comment that, and Sarah knows this, that last week I did take the Iowa test and got confirmed that I could have the test taken. So I did go in on Wednesday and got the swab. And I'll tell you what, after you've had that happen to you, you definitely don't want it to happen again. So I think you want to be very careful. That's going to keep me home a little bit more, simply because that was horrible. It was only a second where they swabbed you, but it was horrible. I did, in 36 hours, I had the results, the negative results. So that was good, but I just wanted to go through that experience and see what that was all about. And you don't want to have to do it. I will tell you that.
So if the county department has work for the person and both feel like they're getting work done, that employee will still keep getting paid, correct? And then if symptoms develop at any point in that, we want the employee to contact their department head. And then I would say that department head would then advise them to get tested at that point, right? If they're on that contact tracing during that time, then the county's advice is going to be to get tested.
And if they're 3 days into it and
Yeah.
they get the test and they are negative, they can come back to work as long as they have a negative. Is that right?
That's not, I said other businesses have done that to get the workers back.
Yeah.
And that was my example. They got.
The window is 2 to 5 days you can
No,
show.
They're showing the people that, they're saying that, so you get the contact trace call.
Yeah.
The people that are positive from that is like 7 to 10%. So 90% of the people are not gonna get it. I wasn't in Courtney's personal space long enough. I was still on the contact. So 7 to 10 people become positive from that exposure, let's put it that way. But it's taking 5 to 7 days after you get that call for those symptoms to really come on, if you're in that 7 to 10% who ends up getting it. Make sense?
Yep.
So businesses that have that, oh, you just get the test and you can come back, I feel like that's a bad policy.
Okay, no,
I would agree.
Okay. So if the department head has work for them, I'm advising, let them work from home.
For those 10 days or
Yeah.
whatever it might be. Yeah.
Because that's still gonna be better for the county in general, because if they do get it, we have that person from home, at home.
you don't want to wipe out the whole class.
Yeah, but if they're critical or they're essential, and like you said, or they're the road grader and don't have symptoms, feel fine, they're only gonna be in their road grader, they want to come to work, self-isolate, stay away, that could be worked out with that department head as well. But the guidance states for essential and critical, at any point, any symptom, that person should go home. At any point, any symptom. Fever starts coming on, a cough starts coming on, a sore throat starts coming on, that should be that trigger to, okay, I need to go home right away, tell my boss, see if symptoms persist, and then get a test. So
Would an essential critical worker, if they were contact traced, would you still require them to come into work and just be in a
if they
mask
do
or
not,
what?
if they don't have to be here. Yeah. But if they already had 2 people out because of cancer and the department only has 3 people and, that's why it comes down to that. Can they work from home? Can you find something for them to do? That's still the best thing. That is still, Hey,
Asking for advice, yes.
still the best thing, but if there's just these departments that only have 4 or 5 people. And then, you know what I mean, like just think of Jason's scheduling. So then you're gonna have somebody work 18 days in a row because that one person came off of the mix, you know, that really is gonna change his makeup, but.
So I guess we're gonna drop some of the language about mileage and those kind of issues. And we're gonna kind of go back to just kind of the department head, the employee, Sarah in the conversation mix, and they will make a decision, and each one will be judged separately. That make sense?
You know, it makes sense. I think we need to drop that 250 people. Makes difference whether you're going to Dickens County to farm or fish or being at a beach party. There's a big difference. And I think we have to give a lot of latitude to our department heads because I think it's a decision we shouldn't make from here. You know, a lot of difference between a person running a lawnmower and a person who is in contact with a lot of people, and it just can't. That decision needs to be made left with the department heads.
Should we remove then the entire travel section? I would.
I think the travel section will just be Xed out. Okay.
Sounds good. You know, going back, I mean, we've already allowed people to stay home, you know, I mean, alternating shifts and that type of thing, specifically with the treasurer's office. And if someone, and so, I mean, we have people that have stayed home. We've already granted that. And since that time, things have really not changed. I mean, we don't have a vaccine. We don't have any remedy for this. So things really haven't changed. So I guess the one thing that I don't want to do or want to feel an employee is challenged with is the fact that, okay, my kid is sick. I'm staying home for 14 days. And then, you know, say 2 months from now, something happens again where they're, you know, I guess I don't want somebody to feel that they are burdened with that and then not obey the social distancing, the coming to work. You know, I guess I'm making myself clear there. I guess I just don't want to. Oh, I have to go to work. I don't want to get to the point where days make a difference of not being at work if they're truly honest with themselves and with the county. So I don't want them to decide whether or not to go to work or not because of this coronavirus. Does that make any sense? You hear what I'm saying?
Yeah, you're making sense. And Dean, you touched on a really good thing. And I think Sarah said it earlier. This whole daycare, the DHS laws and regulations is going to throw a whole new spin on a lot of employees that have kids. I mean, I felt guilty, or I felt 2 weeks ago, Emery had a tooth pop through. She popped a 99-degree temp. Guess what? Guess who's home for 10 days? Me. I didn't have a choice because she didn't have daycare and my husband's gone pushing dirt. So, you know, and I'm lucky enough that I have a job that's very flexible, but there are employees upstairs that have young children that if they go to daycare, when this opens back up, school, they're all going to be sick because they all get sick. And they're all gone for 10 days and they don't have a choice. They don't have a grandma and grandpa. They don't have a spouse. So I think things are going to be real interesting this next year trying to navigate through that.
And if the department heads could just keep working on stuff that is able to work from home and assign that to those people and have that flexibility and latitude, I just think that moving forward, if
And you may have to make a list of
Yeah.
things like, oh, hey,
Yeah.
you do have some.
And if they have any IT issues or stuff that we can be working on with Carl and Dalton to get them set up, just have that open conversation with all the employees so everybody feels comfortable, like you said, Dean, that they're not going to lose their job, that they can still
Right.
be helpful and do work from home. And then I just don't want anybody to waste their golden 10 days when we have options
You don't want that, but you don't want them coming to work
Yes,
when they shouldn't be there
Yes.
because of the fear of not getting paid for their time off.
yes.
So, yeah, or, yeah, I don't have the time, so.
But also, you know best, you know your employees, you know,
Yeah.
you don't want to be taken advantage of either because they need to be working when they can work.
So then the other thing, and Stephanie touched on it on Friday's meeting, I don't know who was all in there. The PPE, so the state has essentially told everyone, well, the supply chain is open, everybody, get out there, buy your stuff, be ready for round 2. Well, you have schools buying stuff, you have all these businesses open, you have restaurants, you have everyone trying to buy PPE. And Steph can explain the glove thing even further, but, they may think one thing, but then when you go to do it, it's another thing. And over the weekend, I saw several emails about people saying they cannot purchase gloves already. And Steph kind of put a warning out there to our county partners on Friday saying that gloves will be non-existent to order in 6 months. So,
I missed that by 5 months and 2.
yeah, well, so do we as the county get more aggressive, or do we have any interest in purchasing, like we did the surgical mask, the 10,000, because we don't know what the fall is gonna bring, and we don't know what problems it's gonna bring to the county with gloves now. I mean, I feel like we're in good shape with surgical masks, face shields. We even have some gowns, I can get some more gowns. But I feel like gloves is gonna be the next thing. And then if we have them, does Courtney run it through the 75%? But then if somebody gets it to a bind, do we as the county give it away to whatever entity is in need, or do we keep it and then resell it to someone? Because there are places that just claim they cannot, they're just not, I guess, aggressive at trying to procure the goods, or they don't like the price, so they're holding off, seeing if they can get a different price. I don't know. Steph's a salesman. She gets.
There was a price increase on nitrile and latex and vinyl gloves, and it went from, I'm just gonna throw out a quick, easy number. Let's say a box of medium powder-free vinyl gloves was $25. They did a 50, or no, it's 100% price increase because it's now $50. And that's at distribution cost. So that would be my cost, not what I add on to your end user. So schools, you know, there's still a percentage that we add on to that. So gloves have gone up extremely. You're not going to see a problem with disinfectants. You will for wipes, but the rest of the products to oversee this season, you'll be fine. But she is right. Schools are placing their orders. They got on board about a month ago. I don't know, gloves. I don't know. I for some reason think that in this fall when we need gloves, maybe the government or somebody's going to come in and say, okay, entities that have it, we have to give it to our doctors because they're now out.
I don't
And
know.
I don't know. It's going to be interesting.
What are we gonna need gloves for?
I don't really know.
Everybody I've heard has said, don't wear them because
Yeah.
all you're doing is spreading germs from one place to the other. You're better off just washing your hands.
The only time really I think you'd need to hear is, let's say somebody comes in, they have a bloody nose. I sure would hope you would
Oh,
put on
sure,
gloves
yeah.
to fill.
But it's
No,
not,
don't wear them.
We need gloves.
If
It's,
the ambulance crew would be the
Ambulance
only one
does.
that I would assume that would be in that.
and
Sheriff's Department.
yeah, law enforcement and jail. But if we have them, if we have the stockpile, are we then like the state and somebody comes to us and says, we have no gloves? Do we then resell? Or do we?
This is my thought. I think we should aggressively look at purchasing the gloves. And when that opportunity and time comes along, I think we should resell
Mhm.
those gloves. I can live with reselling at our cost. I don't know if we need to go back up to the retail price and make money on those people, but I also don't want the local dentist or the local person that or nursing home saying, you know what, this is the easy button. I won't order, I'll just get them from them. I want them to pursue that as
The
hard as
easy
they
button
can.
has been being used, and that's why the state is saying right now, we are cutting off
Yeah.
buy your stuff, but they're telling counties, get some stuff in your back storage room.
Yeah.
So they're
Get your
telling
inventory built up.
us and the coalition, be purchasing this stuff for round 2, but how? I'm with Courtney, I buy the gloves and then we don't need the gloves.
The only,
Can we then, because we did what we were supposed to do,
I would coordinate with Kenny and Carroll and make sure that they're not ordering you, you're ordering both. But if we can bring that maybe all underneath one, and if they need this amount, we order this amount.
okay,
Just so we
and that's what
overkill ourselves.
they're wanting us to have a 30-day supply.
Yeah, and I would assume on gloves, I wouldn't be a bit afraid to push 60-day supply.
Well, they don't
They don't
expire.
spoil.
Yeah.
So,
And Daryl will use them and Kenny will use
Yeah.
them up so we can back off the orders later if we see that we were past that point. But I would surely consider that we should be aggressive, trying to get.
Because the message is, it's kind of what Dean said, each person for themselves, each county for themselves.
Yeah.
And they're saying to work with your partners, work with your
Yeah.
agency, get your stuff ordered, but we're ordering for the what if again.
Okay.
Sarah, what is putting that stuff back out to other entities? What's other counties doing?
Oh, they're purchasing stuff. Yeah, how we set aside the 200,000, we haven't hit that by,
We're not even close.
not even close.
But what I'm saying is, what is other counties doing as far as either charging it back out to other businesses, or are they giving it to them, or what's the other counties' rules on?
It's probably half and half, Gene, because it's you use taxpayer money for this, we're protecting citizens. It falls under the reimbursement category that Courtney has, because you're protecting the citizens of your county with your tax money to purchase that. I mean, so they're telling us, purchase the stuff at the local level so you're not relying on the state to bail you out all the time. Because the state's gonna get the 75. So it's 50-50, Gene. Some counties give it away and they kind of say, okay, we'll give everybody 10 boxes. We did that with some of the Stop the Bleed kids. We did that with the AEDs. We did that with several of those coalition purchases where we just kind of treated everybody the same. So if it came down to it, we could say, hey, all schools get 5 things of gloves. You know what I mean? We'd have to come up with a.
I don't
But at
think,
the same time, I don't want us to be the distributor for everybody. I think that they do need to try to do due diligence, try to buy the stuff themselves too.
Yep, we've been hammering on that, hammer, but we as the county they're gonna say, work with your local emergency management, and it's oh, well, our storeroom is empty. They told us to get stuff in the storeroom.
but I agree with Rich. I think what we bring in is really specifically to take care of our own
Yep.
entity, and everybody needs to get their own box of gloves. I don't think, it's not free, the county paid, and I think there's a lot of taxpayers out there that would not want their taxes to go up because we went and provided gloves to every single person. I think you do resell it, but like Rich says, we are a business, but we're not looking to make money, at least cover our cost.
This is how I would look at it, and I may be way off here, but I would look at Daryl's needs, I'd look at Kenny's needs, and any rubber glove needs we have in the county.
Megan,
And I would order
Yep.
25% more than what they said.
Okay.
And I try to really, and if we have to go to
60
30,
days.
we have to go to 30 or 30% over.
Okay.
But then again, if someone's coming to us with dire needs, then fine, this is what we pay for it, that's what you owe us. Keep really good track of it, so we have a good record of it.
Yep, we
And
have
then-
track of everything we've handed out, so.
I assume Daryl or one of the department heads, they order from a medical supply.
But even those, we're
Are they
starting to
running out
see
like
those.
Owens and Miners?
that are
Zero.
shorted, zero, yeah.
I don't want to get too far behind, especially in his business.
No, and that's why I feel like we should purchase some, but not,
Right.
so we'll go with the 60 days.
I would look at trying to have 60 days. on
Yeah.
hand.
And then, like you said, if we don't use it, then we give it to those departments and they just order
And
less down the
they'll
road.
slowly work it out because they'll only order 10% of what they really need.
Yeah.
instead of-
Okay.
So, the comment that I would make on it is, we are getting hopefully going to be reimbursed 75% for what we purchase. And I'm not sure that the private sector is getting that 75% reimbursement. And although what we spend will affect our budget, it's probably going to affect the budgets of those nursing homes as well. And so I think that is one thing we have to consider. I don't know how to really look at that. I can't, if you're a nursing home administrator, you say, well, I can't buy anymore because my budget does not allow me to do that. And so I don't have that much latitude that I can do that. I'm going to count on EMA to provide this PPE when I need it. Is that a fair statement, Sarah, or not?
Yeah, it's right along in there. So what they're finding is there's corporations. So then the corporate was buying, but the corporate is sending less and less to these. So some of them don't even buy it locally themselves. The corporation is buying it and then shipping it in. But then if they do have an outbreak or something happens, well, I'm sorry, that was your allocation. So it's where they have something and then they burn through and they have nothing. So then the state's argument is those are your residents in that county. Those are your county residents, family members. So that's why the state took out the public-private partnership and said we could give PPE to anyone during this whole 4 months. We don't want a nursing home with 70 people in it, all 70 people die. So, I mean, if they are dire, I'm sorry, we're giving them PPE.
Yeah.
Right.
So, but we have to have some on the shelf to give to them. So we're just doing that mitigation step.
But I do think every scenario is gonna be different and
Yes.
you just,
We're planning for the what if.
So do we know anything about, Courtney, I don't know if there's a question for you or for anyone, or Sarah, if you've got the answer here on this. Do you know when we can expect any reimbursement? Are we submitting these, or are we just keeping tab of what we're purchasing? And at some point in time when it is assumed that this is over, then we can file for that reimbursement?
So they haven't put in, with every disaster, there's a start date and an end date. They have not put an end date on this. So, and this whole time, they've been saying, get your purchases in now because we don't know when the end date will be for that. She can submit them anytime she wants. So it can be an ongoing thing or a stockpile. There was stuff we ordered that it told us it was gonna be 4 to 6 months before availability. There's things that Daryl wants that we still don't have. Like the UV lights, that's something that you're able to reuse PPE if you have the UV lights. If you don't have the UV lights, you're in disposable land and throwing a lot more away. So, but we just can't get some of those things. So the big purchases, we haven't even gotten. So it's just the small stuff.
I think your suggestion, Rich, was probably the way to go. I would say though, if we think that we're going to be reimbursed, I don't want to cut ourselves short either.
I need
That's
60 plus.
along those lines. I think Mills County is still waiting for $38 million from, or $34 million from FEMA. So from the floods of 2 years ago. So
Yeah.
that's how speedy they are. And
But all in all, I don't think, and I know it's 200,000, I don't think the taxpayers are gonna complain about using that money to go back for the protection of the county. We don't wanna be a county with 5,000 cases. We don't even like the 70 cases we have right now,
200,000.
right,
so.
I'm good.
Okay. Courtney, do you have anything you would like to add?
I do. So Gene Miners came in Friday and signed a new Canvas summary because I sent the one we signed before in and it wasn't the right one. So I'm kindly asking
Come on.
you to stop and sign the right one so I can mail it in today. It's got to be signed by a majority of the board, which means I need 2 more signatures in order to mail it in, but I'm open if you guys can make it. I'll take them all too.
It needs to be done
Today.
Today. So Stephanie and I will get it done. Neil, you will be out. Dean, either you're gonna make 4 or we're gonna go with 3.
And
I'll be there.
okay.
I'll stop in.
All right. We'd be okay with 3, but
4 looks better.
it does.
All right. Thanks for that, Dean. Anything else?
I do have one thing.
Gene?
I just wanted to know if,
I'm ready to go. If there's nothing else, I'll make a motion, we adjourn.
I don't think he heard you.
Hold it. We have Gene. Our treasurer, Jean, you know her?
Jean Seidel.
Jean Seidel, she would like to.
She's been here a little while.
What? Yeah.
I just have one question. I think at one of the past meetings, we discussed, the keeping the doors locked at least through July 1st. Has there been more thought given to that? I'd like to know where we're at on that. And I would like to propose that we would keep the doors locked at least now, past July 1st even, until we know what's going on.
There's only 18 recovered, so we got 52 active cases.
And there was some discussion also at one point in time that this could be something that goes until December, who knows? And I think, I just don't want to get in a hurry to unlock those doors yet and let a mad rush of people in. So just wanted to know if you could give me some idea what your thoughts are on that.
Anybody talk to any other surrounding counties and know if they're about ready to make a change, or I haven't, all I've heard is July 1st out of the 2 that I've contacted. I can try to reach out to some of them. And I think we'd be better off to do it as a group rather than individuals also.
But Audubon is at 14 cases.
I know, and sad.
Our number of active, we were more cautious with 20 than, like she said, we're 70 right now.
I was reading,
30.
they didn't take too big a hit.
Well, I don't know if you guys drove by or seen the parking lot, but it's.
Yeah, they were gonna test a lot of people this week, try to do the entire plant in Scranton and Carroll.
Okay.
Oh, I'm talking casino. That
Oh,
parking lot
okay.
is packed.
So you said July 1st tentative. Why don't could we push it back to August 1st tentative and see where these cases end up?
Have you heard the
Green's at
judicial?
28.
I haven't heard anything about
I
that.
haven't heard anything from them either. I'm gonna step up after the meeting. I'm gonna go up and listen to the judicial people and see where they're at.
I talked to the clerk this morning.
Okay.
I visited with her a little bit and I asked her what they're hearing and she said at one time they had heard possibly July 1st, but she said they haven't heard anything more. And she said she thinks that it might be the state looking at each county individually to see where each of those counties are at. And I didn't know, I asked her because I just didn't know this. I said, can the state force us to open our doors for them? And she said, she thinks if anything, if something like that would happen, it would be a case where we could still keep our doors locked, but they would open up more for more appointments and that sort of thing, and they would still come down and get their customers and bring them up, one at a time, and then issue them or walk them back out. So she said as of this morning, they haven't heard anything definite yet.
But yeah, and it kind of depends on how they present it. If they at the state level, they say we're gonna open up all clerk of courts, we're open. And I don't think we have any choice.
Yeah.
And our exposure for them makes us automatically exposed anyway. So it depends on how they offer it. And they present it.
So when they say all clerk's offices are open, does that mean that open again by appointment or just
I
wide
don't
open?
think that.
That's, you gotta get clarification of that.
She was talking about, the judges doing
Coming in, getting one.
teleconferences and they're still doing appointments and they're good. She said, I would really like to see this continue too. She was on board with continuing the appointments too until, things settle down a little bit. So we'll see what happens, I guess.
So what say you? I mean, that's coming up in 10 days. You guys wanna revisit it next Monday,
I think we should.
Wednesday.
Wednesday? I'm sorry.
That's all right. I just want to make sure everybody knows when we're gonna meet.
Next Wednesday, or you would like to make an extension right now, or make it the final decision? What say you?
I would say that we should treat it like the nursing homes and you have at least 14 days of downhill trend in numbers. I mean, that's a good guidance for,
And we're gonna be going into a big holiday weekend.
Yes.
And I know everything's canceled, so what does
Yes.
that mean, everybody?
I mean, I just looked
House parties.
at the recovered versus, like Ida County has 20 cases, well, 16 are recovered. I mean, we have 52 active cases. Ida has 4 active cases. So if you look at the counties around us, more than 75% of their cases are recovered versus we are sitting at newly active cases of people.
Well, should we look at it?
Sarah, don't you think those numbers are gonna go up in those other counties too?
Yeah, like Stephanie said, I mean, if you look at any of those videos from Okoboji this weekend, somebody posted a video of a bar and it was just absolutely crazy. And we have more and more graduation parties are coming now that Kemper was in Carroll. You're seeing graduation invite and 4th of July. So I would be,
We were in Carroll the other night and drove by a high school graduation and they were standing on top of each other. These numbers are not gonna go down.
Well, I know that I'll talk to Scott Jacobs this week, but I was almost certain that I heard that they were actually going to do a soft start to their courthouse on the 26th, which would be on Friday. So, I mean, they're just actually opening up right now. So I can't imagine that they're going to make a big move, to push that opening any further, I'm okay with August 1st. I have no problem with that.
My recommendation, and I'm gonna change a little bit, Dean, I think that we might be getting close to a peak. I don't know that. But in order, instead of quit looking at it as a 30-day issue, I think we should start looking at a 15-day issue. Extend out to July 15th, reevaluate it the week before and see where our numbers are going. Just narrow that window down a little bit versus going out a full 30 days. Now, we may be out 30 days, that very well could be, but
I'm okay with that.
So for our scheduling purposes, we should probably keep that in mind as well.
that Friday with the 15th, and that Friday, I don't know.
15th is a Wednesday.
Is Wednesday, 17th. We'll still at least be doing it at that for your schedule.
So because we don't want to have appointments scheduled through the 15th of August and find out our doors are opening the 1st of August. So we have all these appointments. on this
Exactly.
schedule.
But for scheduling, I think I'd look at least to the 17th of July, and we will make that decision before that. And if we would decide to open up, we're still going to stay close to the 7th.
Well, and you're still gonna have to stay closed as long as they have appointments scheduled out,
Right,
probably.
because I don't want to foo-foo on their parade.
Well, that, I don't know how that would work.
Yeah.
If they had appointments scheduled and then people were waiting too.
Yeah.
Then we're just gonna have more people standing
We're
around.
gonna-
Absolutely.
And when we do, and that's a valid point, when we do, we're gonna have to monitor that door, so many people in. It doesn't matter if we're wide open. If they're going upstairs to the court, upstairs to the court. Don't be leaning on the steps, just go on up. So, all right. Any other topic? Carl got his
So
hand up.
Rich, are you gonna go to the 15th then?
Yeah, we're gonna be the 17th of July. We're gonna at least stay. So Gene can, and the treasurer department can make
Appointments.
appointments. We're gonna go to the 17th of July. That's the Friday after the 15th.
Sounds good.
Okay.
Carl has one thing.
Just a reminder, I need 2 zoning commissioners and 2 board of adjustment members.
Okay, so 2 zoning, 2 board of adjustment members, July 1st. Get your thinking caps on and get your phone calls made. If you've got one, sing out. Send me an email, text, call me, whatever. That way we don't have 5 for 1 and, okay?
Okay, I've got an email here from Dalton about a meeting tomorrow on the 23rd.
Hang on one second.
We have issues. We'll upload it promptly.
See what the subject is?
Yeah, it says YouTube supervisor meetings. We still have issues between Zoom and YouTube. Thanks everyone for your understanding. The meeting will be uploaded to your YouTube promptly.
There's nothing about.
Not a meeting.
23rd.
What does it say, Dean?
Well, it says I got it at 7:48. It's at the same time. It's at the same time that he set up the one for today. But it says Tuesday, Board of Supervisors meeting, 6/23/2020, 9 o'clock to 10 o'clock. And maybe I'm looking at something. I don't know. I mean, well, there's nothing going on, is there? That's all.
No.
No, not that I know of, Dean.
All right. Very good.
All right,
I'll make a motion to adjourn then now again.
okay.
Second.
We have a motion and a second for adjournment. All those in favor say aye.
Aye.
Aye. Opposed? Motion carries. Thank you.
Stay safe, everyone.